Hey everyone, welcome to the third video on basic physiology. This is the circulatory system. This is the last video. We're going to talk about basic ways that the human body functions, and then we're going to get on to more applied topics in terms of emergency first aid. And this one is going to be on the circulatory system. That is to say, the circulation of blood, nutrients, oxygen throughout the body. And this is going to be critical for dealing with things like bleeding, but also other kinds of first aid issues like shock, which we'll talk about in a minute. So the circulatory system, you can see here in this diagram, connects with the systems we talked about before. So there are the lungs that are exchanging carbon dioxide and oxygen, and there's the heart that's pumping blood to the lungs and throughout the entire system. And the circulatory system is just the rest of this. It is the pump, the heart, the pipes, that is to say, the blood vessels, the arteries and the veins and the capillaries that allow the fluid to go through, and the fluid itself, that is to say, the blood. So the things we haven't talked about, we talked about the pump. The things we haven't talked about is all those pipes and the fluid itself. So we're going to spend a little bit of time talking about that and how that functions throughout the human body. So first, the fluid. The fluid, of course, is blood. And that blood has several components to it. One is plasma, and plasma is the actual, if you'd like, fluid of the body of the blood. And that's going to allow for the transmission of other functions through the blood. The other critical element or component of the blood is the red blood cells. The red blood cells, or erythrocytes, are the things that, among other stuff, are carrying oxygen throughout the body. So remember when we talked about the respiratory system, we talked about oxygenation and then the blood's carrying oxygen to all the organs and tissue in your body. Well, that happens by having oxygen bond to hemoglobin. That hemoglobin, basically iron in your blood, is contained in the red blood cells. And you can see here in this picture that you've got oxygen molecules and hemoglobin molecules bonding together. Those then travel to different organs in your body and tissue in your body. They release the oxygen. We don't want to get into the details about this, but they release the oxygen, and that oxygen is absorbed by the tissue in your body. That's how it's delivering oxygen to your body. Anemia is a situation where that hemoglobin is not properly fulfilling that task. Now, realize that already we can notice something interesting, which is that something else may bond to the iron in your hemoglobin and get in the way of oxygen traveling through your blood. This is the effect of carbon monoxide poisoning. Carbon monoxide is readily capable of bonding with iron. And when it does, it displaces the possibility of oxygen bonding with the iron. And then what's carried through your blood system in your hemoglobin, in your red blood cells, is not oxygenated blood that can be delivered to the cells, but rather blood that is fully saturated, but saturated with carbon dioxide, which cannot provide oxygen to your cells. This is why carbon monoxide poisoning is so dangerous. So as a little like public service announcement in this video, let me say that in the winter, you should not be using gas-fired stoves to warm your apartment or your dorm, or using the oven and keeping that on, because both of those are going to create carbon monoxide. Carbon monoxide is odorless, it's colorless, it's not going to make you feel anything except sleepy. So you're just going to go to sleep and you're not going to wake up because your blood will not be able to carry oxygen to your brain and to other vital parts of your body. That's also true in a wilderness situation, whether you're in a cabin, a tent, etc. You have to be aware of the fact that carbon monoxide is deadly, and it's not necessarily connected with other components, particulate matter, etc., that's going to make you cough. You may have no sense of it at all, but it will kill you. Okay, so back to the blood then. White blood cells, or leukocytes, are the things that fight infections. So the white blood cells generally hang out in your circulatory system in weight, and then when there is a foreign body there that could create an infection, they rush to that site and they fight off that infection. So you want to keep those leukocytes available, because they're the things that are going to stop you from getting infected. And infection, of course, in a wilderness scenario is something we're really concerned with. Platelets are the things that actually cause clotting. And when we talk about wounds, we're going to talk about platelets because we really like clotting when you have wounds. In general, you don't necessarily like excessive clotting, right? Because clotting can actually block blood flow in certain parts of your body, in your heart, et cetera. That can create serious problems. We talked about that when we talked about the heart. But when we have bleeding, ideally, the solution is to have the blood clot up so that you don't get a loss of blood. And we actually also have certain things we can do to promote clotting of wounds. And then the other thing that's often not mentioned here is glucose. In the blood is sugar. That's what glucose is. That's an energy source. So whatever you eat in your daily life, this is converted, among other things, to glucose. That glucose travels through your circulatory system, and that's providing energy for the cells and organs in your body. So the cells and organs in your body need oxygen. We've talked about that to a great degree, but they also need energy. And that energy comes from glucose. So later in class, we're going to talk about what happens when that glucose level is off and how it can affect your wellness. Okay, so that's the fluid. The pipes themselves are the vascular system, and that includes arteries. That's coming from the heart. Those are the main pipes that are bringing blood from your heart. That can then get into smaller and smaller arterioles, which then go into capillary beds. And the capillary beds is where the exchange with your tissue happens. So you've basically got blood flowing there through tiny, like 1 cell wide little pathways that is exchanging oxygen and energy with the cells. When it's done that, and now it's depleted of its oxygen and its energy, it goes into venules that then go into veins that go, as you know, back to the inferior and superior vena cava and back into the heart to be circulated around again. Interestingly here, when we talk about bleeding then in this class, we're often going to make a distinction as type of bleeding. If you have, for example, a major cut in an artery, you've got high pressure blood coming from your heart. And so the blood is going to look bright red because it's going to have a lot of oxygen in it, and it's probably going to be pulsing. So you cut an artery and you get that kind of spurting kind of blood. That's a really bad cut to have. On the other hand, if you have a similar depth cut, but in a place where it's only affecting veins, the pressure is less, the flow is less, and so you actually probably will be able to get the clot off much more easily than you would in an artery. On the other hand, if you get a cut in a capillary area, so you get capillary bleeding, that's the kind of bleeding you deal with all the time. You basically cut through tissue, there's blood perfusing through that tissue, so you get some bleeding, but it's of modest volume and modest pressure. So depending on where and how you have an injury, you're going to get different kinds of bleeding, and it's important to be able to recognize those, because a cut in an artery is far more significant and life-threatening than a cut that provides capillary bleeding. That whole system then connects together and is a thing that provides energy and oxygen throughout your body for all your cells to function, for all your muscles to function, for all your organs to function, etc. So far, that's brilliant. The blood that's pulsing through it comes through at a pressure. That's what we call the blood pressure. And we talked about this before. Remember, when the heart contracts, when it pushes blood out through the left ventricle, that creates what we call a systolic pressure. That's a high pressure. That's the pressure that ventricle is able to push the blood out. The diastolic pressure is the pressure when the heart's at rest. So if we take a BP, and we will in class, just so you get a sense of what that's like, but you won't have to do that in a wilderness scenario, because I don't think you're going to be carrying a blood pressure cuff around with you. We're going to get two numbers. We're going to get a high number, which is that high pressure, and we're going to get a low number, which is the normal pressure. The pulse pressure is the difference between those two. So the blood pumps, relaxes, that's your pulse pressure. And those numbers tend to be something like 120/80, measured in inches of mercury, which is a weird thing to measure in, but it doesn't really matter how we measure it. We also have something called mean arterial pressure, or MAP. You don't need to be too familiar with that, but just so you know, that is kind of a weighted average of the two pressures. Basically, the formula is 2 times the diastolic pressure plus 1 time the systolic pressure divided by 3. So we kind of are presuming that 2/3 of the time the heart is at rest, 1/3 of the time the heart is pumping. And so we're taking in weighted average pressure. But it's interesting to kind of think about that, because basically what we're saying here is that we've got closed pipe system of piping, we got a fluid, and we got a pump. And what we want to do is maintain an even, reliable pressure that allows us to bring oxygen and energy to all the parts of the body. We call that system perfusion. And in the medical world, basically perfusion is everything. Perfusion is the thing that allows you to keep living. Perfusion is the delivery of energy, but especially of oxygen, to all the parts of your body. So in the previous lecture, I talked about ventilation. That's air coming in and out of your lungs. I talked about respiration. That's the exchange of oxygen and carbon dioxide with your blood. The next step of that is perfusion, which is the delivery of that oxygenated blood to all your extremities and organs, and then the delivery of the waste product back to the lungs. So that effective delivery is effective perfusion. And we're really concerned about that, because when you don't have adequate delivery of oxygen to parts of your body, you die. So we're really interested in the element of perfusion. And so to look at how that defines things in a first aid scenario, let's look at some pathophysiology. Again, some disease physiology. The critical one we want to look at when we talk about perfusion is called shock. Shock isn't like, I am shocked. Shock is actually a physiological circumstance where you don't have adequate perfusion. So I wrote out a little definition here, which is worth you reading carefully. Shock is a lack of proper perfusion. It can be life-threatening condition. Realize that basically shock can get worse and worse, but at some point you get into irreversible shock where even if you get adequate treatment, you're not going to survive. So as soon as you see any signs of shock, you want to deal with it, or it will very quickly progress to a life-threatening form of shock. So tissues such as muscles and organs do not get enough oxygen and nutrients to function properly, and the byproduct of cellular metabolism, carbon dioxide, is not adequately removed. The result is tissue and organ damage, and this requires immediate treatment. So basically in first aid, it's all about shock, and it's all about treating and addressing shock. So we're going to spend a fair amount of time when we get together in person talking about shock. But right now I want you to be aware of 4 different categories, if you'd like, of shock: distributive shock, cardiogenic shock, hypovolemic shock, and obstructive shock. And some of these are going to be more important for you than others. Distributive shock is basically, and it's going to be a critical one for first aid, by the way, is basically when you've got fluid, but it's not getting out to the right places. And it's generally because of a decline in blood pressure. So you haven't lost any blood, but what typically happens is that your vessels get much larger. You get vasodilation. Vessels dilate, and that means they get bigger. And so basically, you have a certain amount of pressure in a system, if you'd like, in a hydraulic system, because you got a certain amount of fluid and a certain space. If you make the space bigger without increasing the fluid, if you get vasodilation, but you have no more blood, you've got just the blood that you have, then you get less pressure. And less pressure means the blood can't reach your organs. It can't reach necessary tissue. So when do we get that vasodilation that expands the diameter, the cross-section of your blood vessels, and therefore does not allow adequate perfusion? Well, 3 that I want you to be aware of: septic shock, anaphylactic shock, and neurogenic shock. Septic shock means infection. So septic shock, sepsis, I should say, means you've got a systemic infection. So you all know what an infection is. You cut your hand, you had something dirty on it, now it's infected, maybe it's got a little pus on it, it's all red, and it hurts. That's an infection. When that infection, that bacterial infection, gets into the system, when it starts being absorbed by something other than just that local tissue, now you've got the risk of sepsis. So sepsis is a systemic infection. And when that happens, your body does not respond appropriately. And one thing that can happen is widespread vasodilation. And now you've got a drop in blood pressure. We call that hypotension. Hypo is low in medicine. Hyper is high in medicine. We already saw hyper, but now we're seeing hypo. Hypotension is low blood pressure, so the blood pressure is not adequate to circulate to all the parts of your body that you need blood to go to. That's septic shock. It's accompanied with things like fever. So you're likely to see septic shock if somebody's injured or they have some other kind of possible infection. So you have a reason to think about an infection. They have maybe like flu-like symptoms, and especially if they have a fever, then you've got the possibility of septic shock. Anaphylactic shock is a little different. Anaphylactic is your immune system overreacting to some kind of environmental factor. So the way you're probably most familiar with this is anaphylactic shock from like a bee sting. A bee stings you, your immune system freaks out, oh my God, it's a bee sting, and it responds with widespread vasodilation, among other things. Maybe also redness, inflammation, respiratory issues, etc. A solution for that, if you know that you have that sensitivity, is epinephrine in a pen. So we'll actually in class use pens to show you how you treat that. So that's anaphylactic shock. Bee stings are the most common, but you can also get other kinds of animal bites that might create an anaphylactic kind of shock, but you should be able to recognize that. There's a huge difference between a bee sting, even multiple bee stings, and an anaphylactic response. Typically, the anaphylactic response can't happen on the first bee sting because your immune system has to first be exposed to that venom, then it develops an overreaction the next time it sees that venom, right? So what that means is somebody may have an anaphylactic shock who doesn't have an EpiPen and doesn't know that they would have a sensitivity to this because it's only the second time they've been bit by a bee. The other possible shock is a neurogenic shock. Same thing, kind of. Your body gets really messed up because you injured the neurological system. That tends to be more localized in a certain area of the body. So imagine somebody falls off a big boulder and they injure their spine. And so the neurological system is compromised from the waist down. And so now from the waist down, the neurological system is not functioning properly, and you get widespread vasodilation. Basically, the neurological system is not maintaining proper tone for the pathways for your blood. As a result of that, they all open up. And now you're getting inadequate perfusion of the lower parts of your body. So typically when you see this, you're going to see it kind of in not the entirety of the body, but in portions of the body. But if you have reason to believe that there's neurogenic compromise, then it might be neurological shock. And again, we'll talk later about how to deal with this. And this is covered to some degree also in the booklet you've got. Just wanted to give you a sense of these kinds of shocks. So basically, these are all inadequate perfusion, inadequate delivery of oxygenated blood, and removal of the byproduct of metabolism because of widespread metabolic infection, that's sepsis, immune system overreaction to an environmental trigger, anaphylaxis, and neurological compromise, usually as a result of trauma, possibly illness, principally trauma in your case, which is neurogenic shock. Another kind of shock that's out there is cardiogenic shock. Cardiogenic shock means the pump isn't working. Same kind of situation, right? We've talked about the pipes getting too big and now blood can't get to your fingers and your toes. Well, the other possibility is the pump's not working adequately and now blood's not getting to your fingers and your toes, and you're in shock. You should be aware of this, but basically if the pump is not working in that way, you need to get the person to medical care, but you should be able to recognize the scenario. So we'll talk about ways of recognizing that scenario and meet in person. But basically, if you've got cardiogenic shock, you probably have other symptoms related to cardiogenic compromise. You may have somebody who's having clearly a heart attack, chest pain, et cetera, et cetera. And in addition to that, as a result of inadequate perfusion, they also are falling into shock. And if nothing else, those symptoms of shock should trigger for you the urgency of the scenario. Hypovolemic shock. I talked about hypo. Remember what it means? It means low. Volemic means volume. So hypovolemic means low volume. What does that mean? It means principally low fluid. So you've got, again, this system of pipes and pumps and fluid. And one problem was when the pipes got big with the same amount of fluid. So before we had plenty of blood, it's just the pipes got big. Now the pipes haven't changed size, but we got less fluid. Well, how do you have less fluid in your circulatory system? It bleeds out. So one possibility here is you got somebody with significant trauma. They got a big old cut and they bled out a couple of units of blood, and now they don't have adequate blood. So the heart is still pumping. In fact, the heart's probably pumping really fast to compensate for this. In compensatory shock, the first phase of shock, The heart pumps really fast to try to make up for the fact that you're not getting adequate perfusion. The brain's not getting adequate oxygen, and so it starts trying to create higher blood pressure. The heart realizes there's a problem, and it starts pumping much faster, but it's not doing the trick because you've lost too much blood. So the clear choice there is stop the bleeding. If you were a paramedic, the second choice would be and get something in the circulatory system to make up for the loss of volume by putting them in an IV. You don't have that luxury, so you're just going to have to kind of deal with the effects of shock, which I'll talk about in a minute. So hypovolemic shock is low volume shock, and that's basically a loss of fluid. Principal way that happens in your scenario is going to be loss of blood. Other possibility is that people lose fluid from some other way. Fluid is fluid is fluid. So realize, yeah, we're talking about the blood in your circulatory system, but if you lose fluid in other parts of your body, the volume will also be lost in your circulatory system. Basically, it's all going to equalize out. The body will draw fluid out of your circulatory system in order to make up for the loss of fluid through some other means. So how else do you lose fluid? Diarrhea, sweat, dehydration, vomiting. All of these can not only throw off chemical balances in your body, making your blood more, for example, less acidic, which can be problematic, but also it can basically reduce the fluid level in your body. And by reducing the fluid level in your body, reduce the blood in your circulatory system, which means you start experiencing shock. So being a little bit dehydrated is a problem. Being a lot dehydrated is life-threatening, or having severe dehydration. Dehydration, by the way, or I should say diarrhea causing dehydration, is a major killer people around the world. People in the United States don't die of diarrhea, but around the world, contaminated water creates significant diarrhea issues, dysentery issues, and the water that people have available to them in parts of Asia and Africa and other places is contaminated. So they get diarrhea, they consume more contaminated water, getting more diarrhea, which makes them more dehydrated, and they literally die of basically diarrhea. This can also happen in a wilderness scenario where somebody drinks contaminated water, starts getting diarrhea. They drink more of the contaminated water unthinking, and they get more diarrhea. Now they're too exhausted to keep hiking. They've been at the campsite for 2 or 3 days, getting increasingly dehydrated. You run across them, and they are clearly in hypovolemic shock. And you need to recognize that, because that's what you're going to need to treat. Some of the characteristics are in this image here: restlessness, irritability, excessive thirst, rapid and weak pulse. Remember, you don't have enough fluid there, so your heart is pumping like crazy to make up for it, but you can't get a good pulse pressure because you don't have enough fluid. Nausea and vomiting, very common. Rapid breathing, also very common. Your blood is not circulating adequately, so getting the carbon dioxide out of your body is hard. So your body is starting to compensate by breathing rapidly to try to get the carbon monoxide out as best it can. Altered mental state is very common, so you're going to have people that are going to be confused, not making sense, etc. Other kinds of shock, and those characteristics were true of most kinds of shock. Obstructive shock. You're not going to run across this one too much, but I want you to be aware of it. It's possible that your pump could work fine, but something is obstructing your pump and causing it to not work fine. One of those is something we talked about last lecture, which is a pneumothorax. Pneumo meaning air, thorax meaning chest cavity, air trapped in the chest cavity. Remember we talked about a sucking chest wound? What if that creates tension? What if you've got like an air bubble in there, but it's tight? It could actually push against the heart, not just the lungs, which we talked about last lecture, but the heart. So the heart is healthy and wants to beat, but can't because it's being squeezed by the tension of air pushing against it. That's a tension pneumothorax. So if somebody has chest trauma, maybe not even an open chest trauma, maybe not an open chest trauma, but there's some indication of chest trauma, they may have tension with basically a big air bubble in their chest that's stopping their heart from beating properly. The other possibility is it's not air, but it's fluid, in particular blood. And these can be combined, by the way. You get blood and air pressing against the heart. But the other possibility here is you got a sac around the heart that protects the heart and allows the heart to move relative to the surrounding area. If you get blood built up in that sac, that can push against the heart and stop the heart from beating adequately. So if somebody has trauma to the chest, maybe not even an open injury, maybe they just got slammed with a log, or maybe they fell off a horse and got smacked really hard in the chest, You could have somebody with what's called cardiac tamponade, which is a high pressure bubble of blood surrounding their heart that's stopping their heart from beating properly. Both of those could define obstructive shock. You've got an obstruction to the function of the heart. It's not cardiogenic shock because the heart is healthy. It could beat. It's just unable to beat because it's got this bag around it with high pressure. There's a tension pneumothorax. You can see there, this is a CT scan of a tension pneumothorax. And what you see there is you see kind of that big old blood area pushing against the heart. I'm pointing with my finger like that's helpful. Pushing against the heart. And here's the heart here trying to beat, but it doesn't really have the ability to do so. What signs of shock are you looking for? This is tricky. I mean, if you guys were trained to be medics, we'd probably spend at least a few hours on shock, but I don't want to spend a lot of time on shock. So I'm going to just talk about general characteristics of shock so that you will recognize when somebody's in shock and treat them accordingly. And there's not that much you can do, but it's important that you do what you can. So some of the signs: cool, clammy skin. That makes sense because they've got inadequate perfusion. Pale or ashen skin, or what's not there, cyanosis. Oh, it does that gray or bluish tint to lips and fingernails. Yeah, basically those all make sense because they're all signs of inadequate perfusion, right? Inadequate blood and oxygenation to the extremities that indicates possible shock. Rapid pulse, that makes sense. You check their pulse, it's 150. That's a sign that they're probably in shock. Rapid breathing, we talked about that as well. So they're breathing really hard, especially short, inadequate, rapid breathing. That can be a sign of shock. Nausea and vomiting. Why nausea and vomiting? They have inadequate blood flow. So that means they have inadequate blood flow to their gastrointestinal system, which means their gastrointestinal system isn't functioning properly. And so they got nausea and vomiting. This is not good because vomiting is actually going to intensify the lack of fluid that's going to intensify the shock potentially. Enlarged pupils. So their pupils are dilated. That's the term. So you look at their eyes and they're wide open like it's nighttime, but it's daytime. Weakness and fatigue, dizziness, fainting, change in mental status is a key one. Usually it's agitation or anxiousness, but it can be confusion. If it gets to a more serious point where they're really not making sense, you can kind of track that as well. So basically, as you find somebody or work with somebody who's exhibiting the initial signs of shock, inadequate perfusion, old clammy skin, watch them closely. Pay attention to all of these variables, and you might see them increase. And that will give you some sense of the urgency of the situation. Really important that you do that. What can you do for shock? Well, one thing is they're likely to be very cold because they're getting adequate perfusion. If you can keep them warmer, you can improve the perfusion. So get a blanket on them, wrap them in a space blanket. If it's cold outside, make sure you keep them nice and warm. Really critical. It sounds kind of unsatisfying, right? Like this person has this life-threatening injury. What do? Wrap them in a blanket. But wrapping in the blanket is the difference between life and death, because you understand that perfusion requires that they be warm enough to allow that blood, that oxygenated blood, to travel throughout their system. So you want to get the medical assistance as soon as possible. If you had oxygen, you could certainly give them oxygen because they're having trouble oxygenating their blood. So extra oxygen is going to help if you have that. I know you guys aren't, medics or EMTs, so you may not have oxygen, but sometimes when folks are hiking at high altitude, they would have oxygen. So providing them with oxygen could be really helpful. Maybe if you're talking about somebody, if you have scuba gear around, you might be able to provide them with some additional oxygen with scuba gear, something like that. So basically, do what you can to recognize and provide adequate perfusion for them and keep them perfusing, as best as possible until you get them to medical help, and recognize the urgency of the situation. Even those initial signs of shock should be treated as a life-threatening and emergency situation, because folks go from modest initial shock to irreversible shock very quickly. And children, I need to make this point, children especially, will sort of kind of go normal, 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 a little bad, terrible. So if you've got a child who's indicating some signs of shock, they maybe have cool, clammy skin, maybe just a little cyanotic, and you're starting to get worried, realize this is an urgent situation, because that child is going to go from not that bad to horrible very quickly. So that is basically the circulatory system. You now have all the information you need to be a vampire and live off the blood of others, or begin to treat people with first aid. So you can choose either of those, but if you choose first aid, then catch me in the next video where we'll talk about patient assessment.